So you landed on this video because you just got a super cute dachshund or a long-backed breed and someone just scared the bejesus out of you about how they get spinal disease, a slipped or herniated disc, and it costs thousands of dollars at the neurologist. They might need back surgery, they could be paralyzed, or your neighbor had a dachshund and it became paralyzed, so you're freaked out. But I'm glad you landed on this video because there is a lot to learn, and you do need to monitor these dogs that have back disease. So actually, I spoke to a neurologist at Southeast Neurology here in Florida. I'm gonna put their link in my description below because they have a little YouTube channel too, and they post a lot of super smart videos explaining neurological things in dogs. They're all board certified neurologists. It's pretty cool. So when I talk to them, it is true that 25% of dachshunds will have back disease. So that's 1/4 of all dachshunds. So it is something you need to know about if you have one. All right, so I'm gonna throw up a few slides that I've made for all you nerds out there and you visual learners to help keep your dachshund out of that 25% that are gonna get back disease. Starting from the top, keep them lean and fit. Do this with 30 minutes of exercise a day, such as walks or playtime outside. Number 2, guys, use common sense. If you don't want them to get a back issue, don't let them jump off of high places like a tall bed or off the couch where they're gonna have high impact landings that can hurt their back. Number 3, use a harness that doesn't put a lot of pressure on their neck because their cervical vertebrae can also herniate too. Guys, I'm a veterinarian and I love teaching my clients and you guys here through YouTube about veterinary topics. So let's get into what IVDD is. So it's called intervertebral disc disease, or a slip disc or a herniated disc, where the disc literally ruptures into the middle of the spine or herniates into the spine, putting pressure onto the spinal cord. The discs are the cushion-like structures that separate each vertebrae that make up the spine. This disease truly is known as a degenerative disc disease that usually happens in older dogs of other breeds. And over time, the discs lose their elasticity, collagen, and squishy hydration and become hard or calcified and lose their shock-absorbing ability. So the harder or older discs become more susceptible to compression damage. When a forceful movement occurs, the disc can rupture. The contents of the disc will then go into the spinal canal and place pressure on the spinal cord and nerves that lead to severe pain, and prolonged pressure can cause the nerves to die. This spinal cord nerve damage leads to paralysis of the legs, bladder, and even the bowel. The good news is, if this is caught early, a veterinary neurologist who's also a surgeon can do back surgery on these dogs and get that herniated disc off the spinal cord and save these pets from paralysis. Oh no, Dr. Lindsay, you just said back surgery. Is this the only option for your dachshund? And the answer is no. If you notice those signs of weakness, or they're dragging their feet or not wanting to walk, and you quickly get them to a veterinarian, these dogs can be managed with steroids. So a steroid injection to start will be really helpful, and then your veterinarian may send them home with steroids like prednisone, and this helps with inflammation in the spine. This can get them out of their episode of paralysis, and they may never need back surgery. Other things I like to prescribe are muscle relaxants and pain medicine. So those things in combination can help get your dog out of that crisis. You also want to keep them calm and resting if this happens. They can't be running and jumping and playing. They need to be well rested. So the main culprit of your dachshund getting back disease is their gene mutation, which causes their joints to harden early. So it also causes their spinal joints to harden, and they get calcifications within their spine. So these can be seen on X-ray at 12 to 18 months old. And in some countries, these dogs are not allowed to be bred to the standard if they have more than 5 calcifications within their spine. So that is good news for breeding protocols in Europe and in the United States to breed healthy dachshunds. So when all said and done, most dachshunds will get back disease around 4 to 7 years old. But a really cool study over in Scandinavia found that these dachshunds and other breeds too can absorb these calcifications by phagocytosis and an inflammatory process, and actually their discs can sort of heal themselves. And they might just go about their lives and be okay. And they can be treated like some spot treatments with steroids, the muscle relaxers, and things I already explained to you. But they still run the risk of having a herniated disc. But I did talk to a neurologist about this, and he knew about this study too. And so we don't always need to be so stressed out that they're gonna need back surgery, is basically where I'm going with this. So to recap for you guys, here's a slide on a few things that you guys learned in this video to help you out with your dachshunds. So keep them lean and fit. IVDD may be unavoidable, so you need to know the signs of that it's happening. Not all of them need back surgery, and don't be afraid to own a dachshund. Have fun with them, and remember, only 25% of them get back disease. There are dachshund fanatics and breeders out there who are working on making super healthy dachshunds for you guys. That's it, everyone. Bean did a great job for this video, didn't you, Bean? Are you a super strong dachshund? He's so adorable. All right, don't forget to subscribe, and I will see you next week.